Rectal discharge, causes and diagnosis. There are many potential causes of rectal discharge, including gastrointestinal conditions, sexually transmitted infections, and bowel-related conditions. This video will cover rectal discharge in more details, including its causes and symptoms. What is rectal discharge? Rectal discharge refers to any substance other than feces that comes out of the rectum. For example, a person might notice rectal discharge in the form of mucus, pus, or blood in their stools or underwear. Causes. The following conditions can lead to rectal discharge. Hemorrhoids. Hemorrhoids are also known as piles, are swollen veins in or around the rectum or anus. External hemorrhoids develop under the skin surrounding the anus, whereas internal hemorrhoids develop inside the tissue lining the rectum. Hemorrhoids can lead to bleeding and discharge from the rectum. Some other common symptoms of hemorrhoids include anal itching, discomfort, soreness or pain in the anal area, lumps or swelling in the anal area, a burning sensation in the anus, bloody stools either with or without pain. Hemorrhoids are relatively common causes of rectal discharge. According to the National Institute of Diabetes and Digestive and Kidney Diseases, hemorrhoids occur in around 5% of people in the United States and 50% of adults aged 50 years and above. Inflammatory bowel disease. Inflammatory bowel disease or IBD refers to a group of conditions that involve chronic inflammation of the gastrointestinal tract. The primary forms of inflammatory bowel disease include Crohn's disease and ulcerative colitis. Crohn's disease can affect any part of the gastrointestinal tract. However, it most often develops in the small intestine. Ulcerative colitis meanwhile leads to inflammation in the rectum that can spread to the large intestine. The exact cause of inflammatory bowel disease remains unknown, but researchers suspect that the following factors may contribute to these conditions: improper immune responses, genetics, eating a high-fat diet, severe or persistent emotional or physical stress, certain medications such as antibiotics, birth control pills, and anti-inflammatory drugs. Common symptoms of inflammatory bowel disease include diarrhea, abdominal pain, and stools that contain blood, pus, or mucus. Inflammatory bowel disease itself does not cause rectal discharge, but it can lead to fistulas and abscesses near the rectum that often produce discharge. Anal abscess or anal fistula. An anal abscess is an infected sac of tissue filled with pus. Anal abscesses usually develop inside of the infected anal glands. Symptoms of an anal abscess include rectal discharge or bleeding, swelling, pain or tenderness of the skin in the anal region, constipation, fatigue. Without treatment, the infection may spread to surrounding tissue and in some instances form a tunnel between the infected abscess and an opening in the skin. This is known as an anal fistula. Symptoms of an anal fistula include severe anal pain, especially during bowel movements, rectal bleeding or discharge, fever, fatigue. Sexually transmitted infections. Sexually transmitted infections or STIs can spread to the rectum from the genital region or through anal sex. Some STIs that can affect the anal area include gonorrhea, chlamydia, syphilis, human papilloma virus, herpes simplex virus type 2. Some common symptoms of STIs in the anal region may include irritation or itching affecting the anal region, swelling, pain or tenderness in the anal area, rectal discharge, pain, bleeding or both during bowel movements, abnormal growths of skin, blisters or open sores on or near the anus. Proctitis. Proctitis is a condition characterized by a persistent or frequent need to empty the bowels. Rectal pain, abdominal pain, and bloody stools are common symptoms of proctitis. Occasionally, if there is a fistula or uncontrollable diarrhea, rectal discharge may also be present. The following factors can cause proctitis: STIs, foodborne illnesses and other infections, irritable bowel disease, injury to the anus or rectum, certain antibiotics, a history of radiation therapy. Diagnosis. A doctor or other healthcare provider can diagnose an underlying condition contributing to rectal discharge and recommend an effective treatment. The diagnostic process usually begins with the doctor asking about the person's current symptoms, medical history, and family history. They may also follow up with a physical exam. The doctor may use one or more of the following tests to confirm a diagnosis: blood test, stool culture, colonoscopy, sigmoidoscopy, proctoscopy, anoscopy, X-ray, CT scan, MRI scan. When to see a doctor? It is important that people discuss any new or worsening rectal discharge, bleeding, or other gastrointestinal symptoms with a doctor. People may want to consider seeking medical attention for gastrointestinal symptoms that persist for longer than a week despite trying at-home treatments. Rectal discharge can cause discomfort and concern, as it usually signifies the presence of an underlying condition. A person should contact a doctor if they experience any new or worsening rectal discharge. A doctor can diagnose and treat the underlying causes of rectal discharge with lifestyle and diet recommendations, medications, and surgery.